Welcome everybody at my YouTube channel. Today I have a pleasure to have very special guest all the way this time from Canada. Hello Dina, it's really great to have you here and learn more about your path. In a moment we will talk about this, but I'd like to first ask you, how are you today?
I'm fine. Hello, Anita, and thank you for giving me this opportunity. It's really a pleasure to be with you today.
Yes, actually, I was thank you very much. I was very curious about McGill University when you did PhD. And we'll talk in a moment about that in the questions in this Agile interview. But I was really proud to have you here because actually you graduated from university, which is first number one in Canada. And perhaps my, European audience may not realize that. So very prestigious university. So I'm even double happy to have you here. But first of all, also hear from you about your path. So the first question which I'd like to ask you in this Agile short 15 minutes interview would be a little bit about the path, because I always believe that this first question about path can, be inspiration for others, for other people which want to pursue academic career. And I'd like to know from you, why did you decide to become an implementation scientist in Canada?
It's funny, but I didn't plan for it. So back when I started my PhD at McGill in 2014, the implementation science kind of well structured at that moment. So the term or the title of implementation scientist is not that common at that moment.
Mm-hmm.
But I kind of follow my interest in the area that I feel I can really be productive at it. I can provide in that area. So before I applied for PhD, I also get a diploma for total quality management in healthcare. So I this is diploma inspire me about my interest, my career path, that I feel that okay, I can do more than being clinician. I can do more work on quality improvement in getting evidence into practice or getting evidence into action. So
Exactly,
when
especially
I
scientific evidence, because we are overflown, I have impression, with scientific papers, but we have no clue how to implement it. So it's
yeah,
beautiful that you actually had this intuition and follow it. It's
yeah,
amazing. Yes.
yeah, yeah. So this diploma was back in 2009. So it just opened my eyes to what quality improvement, what knowledge translation, and all these kind of knowledge or science. So when I joined McGill, I found this is kind of a career path or something that I can contribute to. So I
Mm-hmm.
start studying knowledge translation and start evidence synthesis and the methodologies and frameworks that how to move evidence into action, uh,
Mm-hmm.
like in a timely way, tailored to clinician and all of these stuff of implementation science. So after finishing my PhD, I find myself still attracted to implementation science. So I was kind of motivated to start applying implementation in many sectors. So I even go beyond implementation and go beyond rehabilitation and implementation and do implementation science research in public health, in primary care, in
Mm-hmm.
pharmacy, in policy evaluation. So I find myself really motivated to apply implementation principles in many sectors, even beyond rehabilitation. So
Yeah,
it's
and also in life sciences and health, right? Yeah, life sciences and health. So that is very interested also for industry, because industries is want to, of course, they want to harvest science into product or technology. So it's
yeah.
beautiful that you
Not
actually
like a trend,
took
now.
took this very, I would say, very interdisciplinary path in terms of implementation, not just theory, studying theory behind it. So
Yeah.
wonderful. Thank you very much. That's been already very insightful and hopefully very inspirational for the audience which is listening to it, scientists, entrepreneurs. So the question two is now based on what you already beautifully described your path, based on your experience, already long-term experience, both as academic researcher and implementation scientist. I wonder actually if you could share with us what do you think what are the main three implementation hurdles where research gets stuck between theory and application.
Okay, I can kind of, from my perspective, I feel that there is a big knowledge gap. So, clinicians and researchers really don't know much about implementation. Still, implementation training is kind of, not well structured, or they are not aware of the trainings or the workshop or the educational opportunities on implementation. So there is a knowledge gap or awareness about implementation science and how we can apply it and so on.
And where to start, right? Where to start?
Where to start, where to go, for who you can seek the information and so on. So, still the awareness itself, we need to work a lot in this area. Second, the skills. So even if you kind of, have a course in implementation or attend a webinar or hear about implementation science in a conference, you still don't have the skills to apply the frameworks and the methodology and how to do it. You need someone to take you hand by hand and have hand-on experience on how to do implementation tailored to your needs and tailored to the project that you're working on. Still, the area of the skills is still, need more work on researchers and on clinician sides. So it's kind of awareness, skills, and I can say resources as well. Because taking courses and invest in implementation, it's not just one person do the implementation, it's the whole organization.
I think it's important also here to bring it that it's not just one, there's no like implementation one officer, which is, representing university, actually each PI, right? Each principal investigators actually would be great if he would have this, a help to get this awareness, right?
Yeah, because back to the core of implementation is moving evidence into action. So this move, it need to be, a whole team, a whole organization desire, so putting resources, infrastructure, education, give more time. So it's kind of resources again. It's again a big barrier for implementation.
Exactly. So I see already some have in front visualizing some institute for it. There must be some, as you said, organization, even institute, because otherwise this cannot be, basically all the needs cannot or demands cannot be really met.
Exactly.
Great. So now, thinking about this, or organization or ways how we could perhaps think about the ways we could ignite, starting small, of course, because as you said, this requires whole village almost. Sounds like whole village of academic researchers and administration effort from each university. But if we can start small steps, I think I would like to ask you, what do you think can we ignite more science implementation by introducing, for example, agile practices? I'm not asking this without a reason, because I'm agile coach implementing agile methodology. So meaning learning by doing. So in short, learning cycles with a short feedback loop. Could we ignite more science implementation using agile?
Yeah, I think it kind of, worked with, fit perfectly with the aim or the goal of implementation. As we know, we already know that one of the major clinician barriers is lack of time. So instead of taking, a whole certificate and implementation or a whole program for 2 years, having these small, short, tailored dose of implementation to their needs, it can work perfectly.
Oh, I'm so
To
happy to hear that from you as an expert. Yeah, it's good because, sometimes I realize when I go back and looking back at what you exactly said about this time constraints, which every academic researcher, more advanced, he of course is approaching career stages, including, assistant professor, from assistant towards full professorship. You see that this time, it's less and less time he has, right? Because he has to take care of all the team, all the group, younger researchers. So this time constraint really is getting really quite. It's getting really less and less time there, and this could be Agile, could be there.
Yeah, and I'm gonna surprise you that this is not only my opinion, it's actually based on one of my papers that I did a meta regression in
Mm.
what type of workshops and educational opportunity that clinician have more adherence to.
Yeah,
And I
because it's not just academic research, but also clinicians, right? If we think
Yeah,
about life
yeah,
sciences and health.
researchers and clinicians. So, what type of knowledge translation intervention that they kind of, have more adherence and recruitment to? And
Mm-hmm.
we find that, yes, the short term or, short term adapted educational materials, they have the highest adherence and enrollment rate or recruitment rate.
Very
So,
important to hear it.
yes, it's
Very
kind of, evidence-based information. Even this
good.
is not just my opinion.
So we can have something to start with, probably, potentially, right? With
I
some
hope
agile
so, yes.
workshops on implementation. That could
Right.
be some
Yeah.
some wonderful idea to help people globally, because that you said, it's not just a problem of one university. This is, as I would say, a global problem, right? Probably at many different universities is overall the same.
Yeah, exactly. Yeah.
So great, wonderful. I'm really inspired, that there is definitely a gap, and we can fill it in agile way, and that really sounds fantastic. So I would like to thank you very much for sharing answers, very insightful answers based on your wonderful long-term or very solidified implementation experience and work. So thank you again.
Thank you again for inviting me and having this opportunity. Thank you so much.
Yes, wonderful, and hopefully we can, come out with agile workshops on it, as we discussed in the last question. So I would be really glad to collaborate with you, Dina.
Sure, me too.
Thanks a lot.
Thank you. Thank you.
So if you have, guys, any questions to Dina, Dina is very lovely, as you can see, open-minded researcher. So she's probably right. Glad to hear in the comments any questions on the YouTube channel, and please feel welcome. So Dina, are you ready to answer all the questions or burning questions? Just to ask you before I will make too strong statements.
Yeah, sure. Yeah. Any questions?
Fantastic.
Ask.
Fantastic. Thank you very much. And it's wonderful to have you here from Montreal all the way. It's wonderful.
Thank you for the invitation. Thank you. It's a pleasure.
Thank you very much. Bye.